Hello, I'm Janice Ellig, CEO of the Ellig Group, Executive Search Advisors, where we are reimagining search by our longstanding commitment to diversity, equity, and inclusion. Thank you for joining us today for another webinar in a series where we invite thought leaders and subject matter experts to offer their advice to help guide us through these very difficult and turbulent times. Today's topic is Powered by Purpose, and I'm delighted to welcome a true expert in her field, Kathy Wengel, Executive Vice President and Chief Global Supply Chain Officer for Johnson & Johnson. As a member of the company's executive committee, Kathy leads all aspects of supply chain across Johnson & Johnson's 3 business units: consumer health, medical devices, and pharmaceuticals. Her responsibilities are quite broad, and they include supply chain strategy, innovation and deployment, sourcing, manufacturing, distribution, and customer service. With that full plate, Kathy also has corporate-wide responsibility for quality and compliance, procurement, environmental health, safety and sustainability, and engineering and property services. So Kathy, you have a really broad array of responsibilities. And recently I had your chairman and CEO, Alex Gorski, on for a podcast. And he said to me, and I quote, "Kathy manages the most diverse and complex supply chain in the world with over 350,000 line items." What keeps you up at night?
Well, first, Janice, thank you for having me here. Hello to everyone, and I certainly hope that everyone who's viewing today is doing as well as we all can from behind the Zoom and within these remarkable times. It certainly changed all of our lives, and something my company is very committed to changing that trajectory of. And you know what keeps me up at night are things that are both sometimes strategic, they're sometimes very tactical, they're often about people and how we live into our purpose. Behind me, you see our Johnson & Johnson credo, which is really the not only the value statement, but it's the guiding principles on how we run our company now for over 135 years. And you know, at Johnson & Johnson, we truly do manage for the long term, but we know to earn that long term, that means you have to deliver value to people, to patients and consumers every single day, and you constantly have to reinvent yourself along the way to make sure you are relevant and driving science and innovation for the future. And so I'd say, you know, over the last year, certainly what's kept me up at night at times is what has impacted all of us. It's how the pandemic is changing not only what we do, how we do it. Supply chains and the role of a team is front and center for all of us as consumers and patients, but really much more clear across the globe how supply chains really are drivers of collaboration across the ecosystem of a company, from suppliers to manufacturers to the healthcare providers and the patients and policymakers around the globe. So, you know, that's really requires us to focus on a few areas I know we'll talk about, whether it's that ecosystem, whether it's scaling digital, whether it's resilience, the power of talent. All of those are things that I know we'll come across and I really enjoy talking about.
Okay, how many people are under your purview, your responsibilities that you're managing globally?
I have about inside the organization about 56,000 folks. As under J&J, we have about 135,000 employees total around the world, so about 56,000 in my team, and just countless thousands of partners, whether it's suppliers, external manufacturers, partners for us in all areas of our business as well.
So you're like a company inside a company.
Yeah, I guess you could, yes. Yeah. Maybe the engine of the company in some way.
The engine. So describe how supply chain, your organization, partners with the different business units and how that actually works.
Sure, I'd be happy to. So, you know, maybe I'll just start with a broad view first for folks who might not be familiar with all of J&J. You know, we're most known for certainly the household brands and things you may think of J&J, whether it's Band-Aid brand, whether it's baby shampoo, Tylenol, household brands, but we are also really the world's largest and most broadly based healthcare company. As I mentioned, 135,000 or so employees around the globe, operations in all major countries, and we reach more than 1.2 billion patients and consumers every day. And our sales last year was about $82.5 billion. And we're divided largely into three core businesses. The first is our consumer health, those brands that I mentioned. If you're a fan of Neutrogena or Aveeno or OGX shampoos, you may or may not know that's part of Johnson & Johnson. And that shows the vibrancy in skin health, in self-care, through our medicines business and other self-care areas, and essential brands. Then about a third of our company is in medical devices. So we're also, extremely broadly based there, with products to carry out surgeries, orthopedic joints, vision. If you happen to wear AccuView contact lenses, my team makes an amazing almost 5 billion of those every year for folks around the world. And even ever had stitches. About 3/4 of the sutures, the stitches on the planet, we make. So it's a very impactful, wonderful place to be. And then the largest part of J&J is actually our pharmaceuticals, our medicines business. It's about half of our sales in dollars, and we are what we call a transformational medical innovator. We focus on some of the most complex diseases or unmet needs in the world. Immunology, oncology, cardiovascular, metabolic disease, and including infectious diseases and vaccines, which is something every one of us have learned a lot more, about over the last year. And I think lastly, you mentioned the 350,000 line items. That's different finished products. We fulfill about 100,000 orders every day from our customers around the globe. And so our job in the organization is not only to help work with R&D to help design those, to find the suppliers that work with us to bring those to life, to make them, to deliver them, to assure the quality of what we do. And digital is becoming more and more fundamental in how we do that around the globe and how we connect with our customers.
Incredible. I mean, the numbers that you put forth, just incredible in terms of keeping all of those, plates twirling at the same time. And then to have to do that during a pandemic as well. Must have been truly challenging for you.
It's a good thing you gotta love complexity and love trying to make it simple and make sure we get great things done for our customers.
So the credo that you mentioned behind you and on your website, you speak of the company's purpose of being about heart, science, and ingenuity. How does this all come together to really drive J&J's purpose here?
Well, you hit certainly on one of my favorite phrases, which is indeed our J&J purpose. And every time I get to say that and share that, I feel like I'm bringing to life, what every one of us are here to do for that more than 135 years. And indeed, that purpose is to beautifully blend heart, science, and ingenuity to fundamentally change the trajectory of health for humanity. And that sounds big because it is a big goal. It's a big aspiration, and it's there to remind us first, when we talk about that trajectory of health for humanity, that it's about doing big things. It's not about being a Me Too company. It's about blending all those attributes. So it starts with that heart, that we know why. Why are we here? We're here because what we do impacts people at often the most vulnerable times of their lives. One of the folks on my team, her first granddaughter was born last night, and seeing that beautiful baby swaddled with her Johnson face there with us, all the way up through cuts and bruises, acne, and then through reconstructive surgery, and indeed medicines that people may need at very difficult times, including a pandemic. Our goal is to really drive forward innovation, but it starts with that heart. That why we're here is about those billion people whose lives we impact literally every day. Then the science part is because we are fundamentally and always will be a science-based company. That means we always follow the facts, whether we are pioneering new science ourselves, or whether we're defending science or integrating science from others. We have to be constantly reimagining what our patients and consumers and communities really need and expect. And the intersection today of what science can do along with technology together allows us to invent, products that we couldn't even think about a few years ago. And then the last word, of course, is ingenuity. And it's about that creative spirit. It's about finding when an obstacle's in front of you, do you go over it, around it, under it? Do you blow it up? Or do you really have to look at it for a bit and understand what it is before you go after it?
So speaking of that, ingenuity, nobody could predict the pandemic that we just, have experienced and may experience again. We don't know what's down the road. So in your scenario planning about managing risk,
Yep.
Was that even part of your plan? Was it in that one of those scenarios of the what ifs could happen in terms of having a vaccine? What did you do to plan for, if you could, in anticipating COVID-19?
Sure. Well, our, indeed, pandemics are something that we think about and work on in terms of our infectious disease business, but it's not something that you actually think will impact at the scale in which this did. I have to say that we certainly can't stand here and say we knew that what COVID was coming at us. So what risk management and resilience and planning is all about for us is it really starts with our strategy about what we're here to do, how we're going to convert that into execution goals based on our value systems, and then making sure that we're really challenging how we improve our operations, how we become more focused to deliver that value. If I give you an example, a few years ago, Hurricane Maria hit Puerto Rico pretty strongly, and it devastated the communications, the infrastructure on the island. And while we had hardened our facilities were generally fine. It was a very different situation when you can't even communicate and know your employees are safe and well. So from that, we had a lot of learnings on the fact that even when we could communicate and found them all and they were all safe and healthy, which was so important, our plants became second homes. We put washers and dryers in. We set up grocery stores because people couldn't take care of their home life. The island was devastated. And from that, a big learning for us was how we then organized various functions in the company to be ready to stand up on a moment's notice when a crisis hit, whether it's the tsunami in Japan, so whether it could be a terrorist incident in the crazy world we're in. And so we set up something called crisis management teams with folks from government affairs, human resources, my team, whatever function is needed. And what that allowed us to do as the pandemic, came is to stand those up first in China, as it emerged in China, and to connect those teams and share learnings, be able to get them the support that they needed, and also share learnings, as that moved around the globe. So that's just one example of how we do risk management, in addition to making sure we can move our people as well.
And I would think probably from this experience, you'll be doing even more scenario planning in terms of the what if scenarios, right? Yeah, because you just learned from this. So today is March 18th, 2021, and Johnson & Johnson recently received their emergency use authorization by the U.S. Food and Drug Administration for its single shot vaccine. Congratulations, that's wonderful. What are some of the key learnings you'll be applying moving forward from where you were to where you are today?
Because of the particularities of what emergency use authorization means, I can't go into any specifics around that, but I can certainly talk about some common learnings that we have across and what it takes to bring something like that to life. And I'd say the one key word is partnership, whether that's internal or external. It starts with having a strong foundation in advance of a crisis. We had a vaccine platform. We had worked on outbreaks. Ebola is our first vaccine from a pandemic perspective. And so we had an underlying platform we could leverage. But then how we worked to do that in a year versus, multiple years, all of that requires deep partnership inside the company and also outside the company as well, to find partners externally, to scale things, to work with scientists around the globe. But it's all based on having foundations in advance of a crisis. It goes to your early question about, resilience, risk management. You need to have that foundation. The crisis is not the moment to realize you have to build, a fundamental capability. You need to leverage that. Alex may have said to you a phrase when he was on about J&J being built for times like this. It's when you really bring your whole career, your whole set of experience to do something, and therefore, allow us to not only do this ourselves, but we think about global standards and how we use global standards to allow us to do things more simply and more consistently. I serve externally as chairman of the board of GS1 Global. That is the global standards organization that sets standards for how commerce flows in the sense of the barcode, the QR code, that international standards organization. The deployment of those across healthcare allow us to do things like making sure goods flow across borders, that we can track and trace where medicines are to make sure that they are authentic. And so the importance of how we partner as a company, whether it's in this area or for any other product, no one company can do anything, anything really, truly just on their own.
Yes, you have to be really proud of the speed at which you and other pharmaceutical firms really responded during this. But it was built on what you said, that foundation that Johnson & Johnson's had with Ebola and vaccines and all the work that you've been doing behind the scenes, and then the partnerships you've built up. And I would assume that from these partnerships now, you'll continue those even more so going forward to prepare for the future. Is that correct?
Absolutely. And there's so many different types of partnerships too. There can be partnerships that we've had for, decades, and there can be new partnerships and new ways of working that you need to do, a spike of work for a short amount of time, that gig economy. And then you move on to something else. So we're really working hard to expand and build how we think about partnerships across J&J, but certainly those that deliver in this type of situation have a big impact.
And a big impact on the customer experience. So I heard you speak at Davos about e-commerce, digital, and how the customer's expectations are changing. So how is this impacting what you're doing at Johnson & Johnson in terms of really that customer experience being even more positive through digital, through e-commerce?
Well, to your point, every one of us as consumers, right, can see digital, and even pre-pandemic, but certainly pandemic, changing how we work. I can tell you, until a year ago, I would go to the grocery store and I would buy my groceries and I would cart them home, and the case of water, this and that, and all of that. And now I use an app on my phone 90% of the time to do that same work. And so that customer experience is completely different for me. And there's some things I get that are better, and there are things that are different, but I think that transcends any industry. So that same, that same on-demand kind of culture also comes through then in healthcare. We all, as healthcare consumers, we want more transparency. We want to be able to see choices. If you think back, 20 or 30 years, your gateway to healthcare was through your general practitioner. And depending on how good they were or not good they were, and what type of healthcare need you have, you would be channeled to a set of choices. Today, anyone, essentially, right, with digital capabilities, you can see ratings of physicians, you can understand multiple types of treatment paths, you can make a much more informed decision. And so those things come because of digital. They come from transparency of data. And so for us, it means a big investment and focus on our digital stack. That's really how we organize data, who we partner with to get customer and supplier information, how we invest in having real-time data where it makes sense. The other thing I'd say digital's driven is really new channels for access. So if I use the same example, think about things that the pandemic has really accelerated, like telemedicine. It used to be illegal in the US to practice telemedicine across the state border. Can you believe that?
Yeah.
And so it took the pandemic to lift some of these rules to give more access, just like more direct shipments to our homes and the amount of things that changed. So, and linked to that is really that personalization of the experience. If I want to go to the grocery store with a mask and my this, then I can make that choice, or I can choose to click. And I think we'll just all see more and more of the world in every industry having that same type of opportunity, but also need for disruption.
And disruption is really so much part of our lives today, and preparing for that. And that's why the partnerships are so important, and reimagining who you are and what you're serving, right? So we do have a question. Let me make sure I get this right. Please find a medicine for Surva. My both shoulders are really bad from past 2 years, have been really bad. So you must be working on a number of different cures or therapies. Is that one of them, or are there others that we can look forward to that you can comment on?
So I'm not personally familiar with that element, and in the shoulders business, we have more in our medical device business around shoulder repair and things like that. We do focus more on our medicines in specialty areas like oncology, as I mentioned before, like immunotherapy, like infectious disease. So those would be areas. But if someone wants to, provide a specific info, I'd be glad to have somebody get back to them if that's an area we're working on.
You are the largest healthcare company in the world, right? So
yes,
you must have a pipeline that you're working on now. So
we do, yes, and one of the things that is challenging when you talk about being the largest is also almost the irony. The other side of the coin is the importance of focus, because it is very easy to think you can just go broader and broader, and yet the reality is in the healthcare world, it's so important to know what you are good at, to have and attract into the company the thought leaders for that, and to be able to then drive that science. And there are many amazing things that other wonderful companies are leaders at that we've elected not to go into, because there are plenty of good, great companies doing that same thing. So sometimes it takes a lot to actually stay focused.
Well, as investors who are out there, they want you to be focused, right? They want you to really focus in on what you're best at, because otherwise it diminishes the value of the company. But if you're really great at, 10 things, really focus on those. Let me ask, there've been so many lessons that all of us have had in the experiences we've had in the past year. What stand out for you in terms of what you want to continue to develop and grow, whether it be, what you're covering now, or what you think Johnson & Johnson needs to focus on more? What are those lessons for you and for Johnson & Johnson going forward?
One, I think, certainly is in the resilient space and the importance of investing in strong foundations that you may not know right now exactly how you're going to leverage, but you know that it's a key capability you need for the future. So I think that's one. I think the second is knowing the purpose, right? The purpose of your company, and therefore how that guides strategy, and your personal purpose. What are the things that you value? What are the things that are important to you personally? And in a time like the pandemic, how are you ensuring, as the world goes crazy, that you're able to do those things that are important to your family, even if you can't do them in the way you might have done them in the earlier time. Same thing in the company. There are things we have to work in different ways, but being agile and flexible, but being very clear about what the goal is. I think that's one very important lesson. And the second was make sure the data guides you. That's something as a science-based company is key, but the amount of listening that was needed from the beginning in Wuhan pandemic as it came around the globe, and how we stayed 2-3 days, weeks ahead of things to make sure we could supply our critical healthcare products as needed around the world. A fun fact, or not so fun fact, but pre-pandemic, about 70% of the medicines in the world travel by air to get where they're going, if they're crossing a border, and 80% of those flew in the belly of commercial passenger aircraft.
Oh, I didn't know that.
So imagine what started to happen in April and May last year, when all of that aircraft almost essentially came to a halt, and how as industry we were able to track and trace, know what was where, but find new ways to make sure that those key medicines got where they needed. So you need that underlying infrastructure. You need that sensing from the outside in to see if we could be a few hours ahead of somebody else, we could grab that boat versus another way. And then, it's about that preparedness, but it's really then about something that's personally important to me, and that's building diverse and inclusive teams. And I'm extraordinarily proud. My leadership team is 50-50 male, female. We continue to become more and more diverse in terms of all areas, whether it's background, whether it's race, whether it's experience, whether it's globality and where people have grown up in their cultures. And I think I know it's clear that diverse teams will always find more creative, more diverse opportunities and ideas, not only in the day-to-day, but also in a crisis, that allows you to deliver so much more than you could with any kind of fully homogenous type of team.
Well, and Alex said that so clearly on the podcast, which is now on my website, clearly that you have a highly diverse board, highly diverse management team. He talked about all the women, running major divisions such as yourself, and then the highly diverse board, women, ethnicity, really truly diverse. And I said, Alex, no wonder you're so successful. You have all this diversity around you.
Right.
And he agrees, because it's the diversity of thought and thinking that really comes to the best decisions and best corporate governance. So we do have another question here, Kathy, if you have time. In the early months of COVID crisis, we saw critical shortages of PPE and other medical supplies. While the sudden spike in demand was unpredictable, were there lessons learned about supply chain management and inventory management? Well, you answered some of that, but anything you had?
Sure. Yes, and it's a great example, and I think I can answer both at the let's say the company level and maybe a U.S. country answer too. So PPE, in fact, is part of our risk management at J&J. We had a stockpile. We had stockpiles in each region of PPE. And in the very early days, in the first few weeks when it was clear the pandemic, or excuse me, at that time, the Wuhan outbreak, we actually donated a good chunk of our Asia stockpile, 1 million masks to Wuhan, because we knew and understood from our infectious disease experts, frankly, who could see where this could head, how important it was to help do anything we could to get containment. Unfortunately, no matter how well people were working and to get there, that containment clearly didn't happen. But that was an example of us from a community and risk management. And I'll tell you, there were days a month later, many days, if you'd asked me a year before, would I ever have people planning PPE, I would have, smiled and said, yeah, that's very funny. But then we had a team of people literally planning down to the day the PPE we needed in our plants, in our distribution centers, to keep running, through that period, because we indeed did use our stockpile. I remember one night, you asked what keeps you awake at night, the one night thinking, my God, we make it through this far and we could go down because we don't have PPE. And we made it through. We came very close, but we made it through with no disruption. But that's, again, based on planning. I think there were some learnings, certainly in the US, we all heard the publicly reported discussions of the US stockpile and some of that material not being usable. So I think they're very important lessons. Stockpile doesn't mean you put something in a vault and you close the door and you open it 10 years later, right? You have to keep your stockpile or your as part of your resilience. You have to be using it and refeeding it so it's there when you needed it. And certainly a lot of companies around the world, a lot of work done now on that too.
So I'm going to ask you this question that came up as well, but then if the closing comments that you might have in terms of targeting certain zip codes where there are poor health issues, impoverished communities. Are you able to do that in terms of, and for a lot of essential workers live in these communities as well? Has that been successful with your vaccine and others?
Sure, glad to talk about that. So as we're all in emergency use period right now during the pandemic, the distribution of vaccines is managed completely by the federal government here in the U.S. So under normal medicine, in a normal time, we would be distributing and working on that there. In this case, all of us provide that vaccine to the government, who then, based on the needs of the states, does that distribution. So everything we make, goes to the government based on those agreements. Now, having said that, we have a very public commitment on race to health equity to really work to eliminate disparities in health for communities of color. We have very active discussions with the U.S. government, with states, with communities about how to do that, and happy to point folks to see our external commitments on how we do that.
So your race to health equity, is that on your website? Because Alex talked about that as well.
Yes, it is absolutely.
So look at that in terms of what you're doing, that initiative, which I think is so needed, and I really commend you and the entire organization for driving that.
Yeah, no, thank you. And they can take a look at that, and key pillars about people first culture, healthier communities, working together, and alliances that really help change the game.
Well, this has been a great discussion. And you are leading just a huge organization within Johnson & Johnson. Any parting words that you have for our audience, even themselves, in terms of their health going forward, how to look at the world going forward, given your experiences, Kathy?
Well, first I would say, know what it is at a personal level, know what it is, or find what it is that you love to do. And if you can build your career around it, you will do it 10 times better and be 10 times happier than if you're doing something that doesn't inspire you. So that's the first piece that I always talk about. And I think it's super important. And I think it also then applies to companies, as we've talked about. It's know what makes you special. What is the value proposition of your company? And don't be led down the garden path, right? You can expand that, you can grow that, but it's so important to know what you're there to do on this planet, and then be able to bring your whole company to it. And for us as individuals to be in a place where you can bring your whole self to that, and that your diversity, your uniqueness as a person is a cultural add to the company, not a cultural fit, but it's something that brings something to a company or your nonprofit or your own entrepreneurial endeavors. Those are the things that really power me.
It's interesting you say add to, not just a cultural fit, because when we're placing candidates into positions, we say it's not a cultural fit, it's a cultural enhancement that they're joining this company. And you are such a purpose-driven organization, from the boardroom to the C-suite and all the way through the whole entire organization. Kathy, thank you so much for being with us today. It was really a joy. And I think there's a lot that's going to keep you up at night for many months to come.
Well, thank you, Janice. And the good news is I have an amazing team. So there would help make sure that I can also sleep well at night. And it's been terrific to be with you and the audience. Thank you again for the invitation. Really appreciate it.
Kathy Wengel and Johnson & Johnson, Alex Skorsky, all your entire team. Thank you for all that you're doing for the world.